Welcome, and thank you for joining us today. This is the question and answer session for May 7th. Public Health Director Annette Rodriguez and Dr. Chris Bird will be addressing questions received this week. Please feel free to add your follow-up questions to chat. Dr. Bird?
Okay, we have a few questions this week. First of all, Annette, how are the vaccinations going this week?
So this week, they really slowed down. So I think we did under 2,500, maybe 1,000 first doses and close to 1,400 second doses. So it's really slowed down a lot from what we used to do. We're just trying to think of more ways to find people and get them vaccinated. So we're still at Buck Days till this weekend. If you attend Buck Days and you want to get in for free, please stop by our booth. We're right by the gate, and you can get in for free once you're vaccinated.
All right, so if anybody out there has suggestions on or ideas of how to improve the vaccine availability, feel free to let us know. Let's see, we've got a few questions here. The first question is, do you know of any local pediatrician offices that are participating in a COVID-19 vaccine clinical trial?
I don't know about pediatric offices per se, but I do know that there are clinical trials being run here in Nueces County for pediatric doses. So if you're wanting more information because you want to participate in one of those, you can call the health district at 826-7200, option 2, and they should be able to give you that information as to where they're at. The only issue that I have with it, while it's great and we all know how important clinical trials are, part of the group gets a placebo, so they don't actually get vaccinated. And I want everybody vaccinated right now. So they will vaccinate them when the clinical trial's over. But the clinical trial may not be over for 6 months or even 9 months. And after that time, they'll tell you if you were in the placebo group, and then they'll vaccinate you. So I hate to say this because I know scientists, live for these clinical trials and they're important to us as well. But right now, my suggestion would be to actually go to a pediatric office. I know Almui Pediatrics is giving COVID-19 vaccines. And so actually get your child vaccinated at this point.
Yeah, I was gonna ask, aren't they about to approve the vaccines for everybody? Like everybody
Yes.
of all ages?
Well, not all ages. The one that's about to be approved is 12 to 15, and that's going to be a Pfizer vaccine. We don't know what the dosing amount is yet until it's actually approved, but we're thinking in another couple of days here it'll get approved. Once it's approved, we're thinking it might be the exact same dose that we give with the Pfizer right now to the adults. If it is, we would have it available immediately, so we'd open it up to that age group. In September, we're hearing that it's going to open up to the 3 years of age and older. And so it'll have gone through the clinical trials, it'll have gone through the FDA for EUA approval. And so around the middle of September, they're looking at that's about the time frame that it's going to open up COVID-19 vaccines for the younger population.
Okay. So the next question is, what are the odds of a child being given the placebo instead of the vaccine? I'm guessing that's 50%, but you can correct me if I'm wrong.
Yeah, I would be guessing about the same, so 50-50 chance that you'd be getting an actual vaccine versus a placebo. But I don't know the exact percentage.
You're going to want a fairly equal sample size for both categories to be able to compare accurately. Let's see. We heard
Go ahead.
Dr.
Bird, I will say that some of these places that are doing these clinical trials are actually paying for you to bring your child in and to get them vaccinated, so up to $250 a vaccine. And so I know some people are actually on a waiting list currently. So I don't know that there's availability out there right now, but if you wanted to get on a waiting list again, you could call the health district and we can give you that information.
Okay. Yeah, that makes sense. I used to work in a psychopharmacological lab before I went to graduate school, and we would give people $100 to take a drug and see how it affected them. So that sounds like, given how many people have already gotten the COVID vaccine, it seems like that's a pretty safe bet to get that money. without a lot of
That's an
side
interesting
effects.
name,
Yeah,
a psycho.
psychopharmacological.
I just heard the psycho part.
All right. So we heard in the news that Pfizer is seeking FDA approval for 12 to 15-year-olds as early as next week. Just to reiterate, when do you foresee children under 12 being vaccinated? It seems like the answer to that was September.
Right. So probably around the middle of September is what we're hearing for under the age of 15. So, but for 12 to 15, we're hoping as soon as, Monday, Tuesday, Wednesday of next week, as soon as we're given the green light, we will be open and available for business at La Palmera Mall every day, Monday through Sunday, from 10 to 8, except on Sundays it's 11 to 6. So we hope that you bring your kids in at that time. We're also going to have a clinic at Richard Borchard Fairgrounds next week on Wednesday. It's really for second doses. We have about 750 people that need second doses, and so we're going to do. It's going to be a walkthrough again. We did a drive-through this week, but it's too hot, and we have to watch the integrity of the vaccine. The vaccine has to stay below 77 degrees, and so we're going to go back to a walkthrough. It's much faster. You just walk right in and you walk right out. I know people think, oh, it sounds so inconvenient, but it's actually super convenient. You're not waiting with your car idling or any of those types of things. And if we have the approval, the FDA approval for those ages 12 through 15, we will probably open up that Richard Borchard drive-through that walkthrough for those individuals as well.
Yeah, I agree. The walkthrough was way better than the drive-through. The drive-through was kind of a nightmare.
Right, long and tedious, and
Yeah.
some people keep, complaining that they want the drive-through back, that they didn't want to walk in with a bunch of people, but we're trying to, if you could still social distance, stay your distance,
Yeah,
watch those things.
keep your mask on, no problem. I mean, you're in and out. It was way better. I mean,
You're in and out, you go straight to get vaccinated, you go sit down, and then, your time's up and you've got to leave.
yeah. I'll also point out, I went to the local CVS on Alameda, and they were giving out vaccine shots right there at the door.
Oh, that's great.
Or I don't know if
I'm
they were
glad to
giving
hear
them
that.
out. I didn't ask if it costs anything, but anyway, there was right there at the pharmacy.
No, there cannot be a cost for any of these, not even if you're vaccinated at the hospital. You can't get a bill later saying you owe $100 for a COVID vaccine. There's absolutely no charge to you for a COVID vaccine. So I heard at Walmart too, I was in Walmart, and I heard them announcing if you're wanting a COVID vaccine, come by the pharmacy. So I'm hoping that they're giving them right there and then, because I had originally tried to get online at Walmart, and it was a little bit of a process, and I was thinking I need to be sitting here, make it as convenient as possible, kind of like you're saying, Dr. Bird. So I'm glad to hear that. So I hope they vaccinate them right there. One of our new thoughts is that we're going to ride the bus. And the reason we're going to ride the bus is anybody that gets on that wants a vaccine, we're going to vaccinate them. And so that's our new way of vaccinating, as many people that are riding the bus that we can. And so if you see us on the buses riding around, it's not that we're wasting time, it's that we're trying to vaccinate people.
All right, yeah, that sounds fantastic. So that's all the questions we had beforehand. It looks like we may have gotten some questions while we were talking here.
Yes, we did. So I see San Francisco may be ahead of most major cities in getting its people vaccinated. News says they went into a strict lockdown and now will allow major restrictions to be lifted. How does this concept stay in place when the U.S. is so mobile and they are not in a bubble? There's more. Even in Texas, if Corpus gets to herd immunity and other Texas City residents visit over the summer, what is the impact to Corpus?
Okay.
Go ahead.
So here's how herd immunity works. If, let's be real optimistic here. Let's say that 80% of the people of the coastal bend are immune to COVID because they've been vaccinated or they had it in the past. If 10% of the people in the coastal bend are from outside and didn't get vaccinated and haven't had COVID, still the thing is everybody's immune. So there's not really going to be a big increase in transmission rate just because people are traveling around. So the way that herd immunity works is that people are immune, so the virus can't get passed on, or it's extremely unlikely for it to get passed on to the remaining people that haven't gotten it. So a herd immunity sort of scenario, it's not a countrywide thing. It's a location based, location by location. Some places might have it and some don't. And as long as there's a good fraction of the population is from the local area, and even if everybody coming in from somewhere else is susceptible to COVID, it still won't have a big effect. So I think that answers at least the back part of that question. I don't know about the first part. I'll let Annette take that.
I think adding on to what Dr. Bird said is that while that sounds great for Coastal Bend or Nueces County, and that's what we want to accomplish, we want to get to herd immunity. We have to remember that if the rest of the world is still transmitting COVID-19, then there's still the potential to have variants that come into play. And so we're seeing a lot of variants. Currently, we have 5 variants of concern here in the United States. There's variants of concern in different parts of the world. And so it could end up that if everybody doesn't get this under control together, if we don't have some solidarity here, that we're going to have to deal with a variant of this COVID-19, of the original COVID-19. And that's why you keep seeing public health saying, get vaccinated, vaccinate your kiddos, bring them to us. We're reaching out to the schools. We're going to the schools. We're vaccinating at the schools. We're asking parents to consent to allow us to vaccinate their kids there at the school. So that way you don't have to go out of your way and come to the health department or come to the Richard Borcher Fairgrounds or the American Bank Center. So we're doing everything we feel like in our power to try to get everybody vaccinated. But again, the solidarity part of it is so important. And so I think I don't know if I answered the first part of the question, but even if California is able to do all of these things, again, they're not going to be successful unless all of us are successful.
Yeah, I agree with that. And so the thing that's uncertain here is will COVID continue to evolve? And the more people that have COVID, the more COVID that's out there, the faster it evolves. The less COVID that's out there, the slower it evolves. And the one thing that can happen is there could be a reset of this whole thing if a variant comes out that's immune itself to the vaccine. And so that's why we want to keep the numbers low, and we don't want to go back to a scenario where there's a new version of COVID that everybody is susceptible to again. So that's one of the big concerns. And for places, really I think at this point it's places outside the United States where there's less vaccinations, where there's the hottest spots of COVID right now.
I think the other part of that is that we're still looking at that. That we believe that the end of May, beginning of June, we're going to start seeing some increase in our cases, increase in our kiddos that are getting COVID-19. We've already seen some daycares that have had to close because of too many cases in a daycare. And that really is concerning to us. And so we hope that everybody does their parts. I know I had a comment that was made about the bug days, a lot of people aren't wearing their masks. That's very unfortunate. It shouldn't take government mandating for you to wear a mask, for you to do what's right for yourself and for your family members and for your loved ones and your friends. Because while it wasn't mandated by the governor, it was mandated by bug days to wear masks. And people have been penned up for so long. I understand wanting to take it off. And we all saw that CDC said you could take off your mask if you've been fully vaccinated, which means it's been at least 2 weeks after your second dose or at least 2 weeks after your J&J dose. But it didn't say that if you're in a congregate setting. It's basically if you're outside walking on an Ocean Drive and there's nobody around you, absolutely. Or if only your family members are walking or biking with you, absolutely you can take off that mask. But if you're in a congregate setting, and Buck Days is a congregate setting, you should continue to wear your mask to protect yourselves and others from getting the virus and transmitting it. We all know kids aren't vaccinated, so they can still be transmitting even though they're not symptomatic.
Yep, and it's important to realize that the pandemic's over when COVID stops getting transmitted. So by not wearing a mask, you're helping to keep COVID go longer than if you do wear a mask.
I have another question from Patty. I saw there might be a possible link to people who were never diabetic becoming diabetic as a side effect of COVID, and we have seen it attacking other major organs long term. Is the vaccine supposed to prevent this if a person has a breakthrough case of COVID? Good question.
It's a great question. You know, we heard early on that people that got COVID, that it seemed like it attacked people that maybe were more prone to get some type of a chronic illness later in their life. It really didn't realize that they were going to have that problem. So that could be part of that question. Breakthrough cases, we've seen quite a number of breakthrough cases. I want to say over 600 breakthrough cases here locally. But the majority of the ones that we look at that we're more concerned with are those that are tested as a breakthrough by PCR, which means that they're tested with our gold standard. You know, we've all talked about being swabbed and it goes through your nasopharyngeal. Those we've only had probably, I would say, less than 150 of those cases. The majority of those cases, I've only seen 2 that were hospitalized. One of them had a co-infection, and so the vaccine is doing what it's supposed to be doing, which is keeping us from having severe illness to COVID-19 or ending up being hospitalized or even causing death. And so it's working, but people still need to get vaccinated. I'm not sure if I answered all of that question, Dr. Bird, if you want to jump in.
I thought it was outside of my realm of expertise for the most part, so I was going to leave that to you.
Okay, so yeah, that's all I know. You know, that's probably going to require, you know, a lot more studies from the medical professionals to tell us, you know, about the diabetic correlation to COVID-19.
Thank you.
Is that all, Tiffany?
Yes,
All right.
that's all I see.
Well, I want to thank everyone for watching, especially if you submitted a question. In the Q&A, there's no Q without you. To that point, please share this with your friends. There's no telling who you might help by sharing information. The next task force report will be uploaded later today. I'm assuming we didn't check this, Dr. Bird.
The task force reports will be every other week, but we decided after we initially decided that these Q&As were going to be every other week, but we got some messages this morning that made us reconsider. We'll be doing the Q&As every week, and the pandemic report updates will come out every other week at this point.
Next week.
Next week, that's right.
Okay, thank you. Also, we will be moving up the question and answer session next week. So please join us every Friday now at 11:30 for the question and answer session. Please remember to direct questions or comments to @CBCovid on social media. Have a wonderful and safe weekend.
Thank you.
Thank you.